Appendicitis is a common surgical emergency encountered by medical professionals worldwide. It is a condition that requires immediate attention and intervention to prevent serious complications. It represents a significant cause of acute abdominal pain, particularly in younger individuals. The pain often starts near the navel and then shifts to the lower right abdomen, becoming more severe over time. This clinical guide provides a comprehensive overview of appendicitis, encompassing its epidemiology, pathophysiology, clinical presentation, diagnosis, treatment, and potential complications. Understanding these aspects is crucial for effective management and treatment. Prompt recognition and timely intervention are crucial in managing appendicitis effectively. Delays in treatment can lead to the appendix bursting, which can cause peritonitis, a serious infection of the abdominal cavity. Early diagnosis minimizes the risk of complications such as rupture, abscess formation, and sepsis. Diagnostic tools like ultrasound, Connecticut scans, and blood tests play a vital role in identifying appendicitis early. This guide aims to equip healthcare providers with the knowledge and tools to accurately diagnose and manage appendicitis, ensuring optimal patient outcomes. It covers the latest advancements in diagnostic techniques and treatment options. The information presented here is intended for medical students, residents, and practicing physicians. It serves as an educational resource to enhance their understanding and skills in managing this common yet potentially dangerous condition. It serves as a refresher on the key aspects of appendicitis, incorporating the latest clinical guidelines and evidence-based practices. Staying updated with current medical literature is essential for providing the best patient care. By understanding the intricacies of this condition, healthcare professionals can provide optimal care for patients presenting with acute abdominal pain, potentially saving lives and improving overall health outcomes. Effective management of appendicitis not only alleviates patient suffering, but also reduces the burden on healthcare systems. The appendix is a small finger-shaped pouch that extends from the cecum, the beginning of the large intestine. This tiny structure, often overlooked, plays a more significant role than one might initially think. It is typically located in the lower right quadrant of the abdomen, nestled comfortably in a region that can sometimes make it difficult to pinpoint issues. While the exact function of the appendix remains a topic of debate, it is thought to play a role in immune function and gut health. Some researchers believe it acts as a storehouse for good bacteria, helping to reboot the digestive system after diarrheal illnesses. The appendix has a narrow lumen that can become easily obstructed, leading to inflammation and infection. This condition, known as appendicitis, can cause severe abdominal pain and requires prompt medical attention. Its blood supply is derived from the appendicular artery, a branch of the ileocolic artery. This artery ensures that the appendix receives the necessary nutrients and oxygen to function properly. The appendix is also innervated by visceral nerves, which explains why appendicitis pain is often poorly localized. This diffuse pain can make it challenging for both patients and doctors to identify the exact source of discomfort. Understanding the anatomical location and structure of the appendix is crucial for accurate diagnosis and surgical management. Surgeons must be well versed in its anatomy to perform successful appendectomies and avoid complications. Its proximity to other abdominal organs can make diagnosis challenging, as pain can radiate to different areas. This overlap in symptoms with other conditions necessitates careful evaluation and often imaging studies to confirm appendicitis. Appendicitis is one of the most common causes of acute abdominal pain requiring surgery. It affects approximately 7% of the population at some point in their lives. While it can occur at any age, appendicitis is most prevalent in individuals between 10 and 30 years old. There is a slightly higher incidence of appendicitis in males compared to females. The reasons for this gender difference are not fully understood. Some studies suggest that hormonal factors may play a role, while others point to anatomical differences in the appendix. Certain factors can increase the risk of developing appendicitis, including a family history of the condition, a low-fiber diet, and gastrointestinal infections. Early recognition of these risk factors is essential for prompt diagnosis and treatment. Section 4. Pathophysiology, the inflammatory cascade of appendicitis. Appendicitis typically begins with obstruction of the appendiceal lumen. This obstruction can be caused by various factors including fecaliths, which are hardened stool, lymphoid hyperplasia, which is the enlargement of lymph tissue, foreign bodies, or even tumors. The obstruction leads to a buildup of mucus within the appendix, creating a breeding ground for bacteria. As bacteria multiply, the appendix becomes inflamed, swollen, and filled with pus. This inflammatory process can progress rapidly, leading to complications if left untreated. The inflammatory response in appendicitis involves a complex interplay of immune cells, cytokines, and other mediators. Understanding this inflammatory cascade is crucial for developing effective treatment strategies and preventing complications. Section 5. Clinical Presentation. Recognizing the symptoms of appendicitis. The classic presentation of appendicitis is characterized by a specific pattern of symptoms. It typically begins with vague periumbilical pain that migrates to the right lower quadrant of the abdomen over several hours. This pain is often described as sharp, constant, and worsened by movement or coughing. Other common symptoms include loss of appetite, nausea, vomiting, low-grade fever, and constipation or diarrhea. Patients may also experience pain during urination or defecation if the inflamed appendix is irritating nearby organs. It's important to note that the presentation of appendicitis can vary, particularly in children, the elderly, and pregnant women. In these populations, the symptoms may be atypical or masked, making diagnosis more challenging. Section 6. Diagnosis. From physical exam to imaging studies. Diagnosing appendicitis relies on a combination of clinical evaluation, laboratory tests, and imaging studies. Each of these components plays a crucial role in piecing together the overall clinical picture. A thorough medical history and physical examination are crucial initial steps in assessing patients with suspected appendicitis. The physician will ask about the onset, duration, and nature of the pain, as well as any associated symptoms such as nausea, vomiting, or fever. During the physical exam, the physician will palpate the abdomen, looking for signs of tenderness, guarding, and rebound tenderness. These signs can help localize the pain to the right lower quadrant, which is often indicative of appendicitis. Specific physical exam maneuvers, such as the Robsing sign and the Soas sign, can help elicit pain suggestive of appendicitis. The Robsing sign involves pressing on the left lower quadrant to see if it causes pain in the right lower quadrant, while the Soas sign involves extending the right leg to see if it causes abdominal pain. Laboratory tests, such as a complete blood count and urinalysis, can provide supporting evidence of inflammation or infection. An elevated white blood cell count may indicate an infection, while urinalysis can help rule out urinary tract infections or kidney stones. However, these tests are not specific for appendicitis and should be interpreted in conjunction with clinical findings. The results of these tests can help guide the physician in deciding whether further imaging studies are necessary. Imaging studies play a vital role in confirming the diagnosis of appendicitis. They provide visual evidence that can help differentiate appendicitis from other conditions that may present with similar symptoms. Ultrasound is often the initial imaging modality of choice, especially in children and pregnant women. It is a non-invasive and radiation-free method that can effectively visualize the appendix. It can visualize the appendix and detect signs of inflammation, such as thickening of the appendiceal wall. Additionally, ultrasound can identify other potential causes of abdominal pain, such as ovarian cysts or gallstones. Computed tomography scans are highly sensitive and specific for diagnosing appendicitis. They are often used when the diagnosis is uncertain or when complications such as abscesses or perforation are suspected. CT scans can provide detailed images of the appendix, surrounding structures, and any potential complications. This level of detail can be crucial in planning the appropriate surgical or medical treatment. The choice of imaging modality depends on factors such as patient age, pregnancy status, and the availability of resources. For example, MRI may be considered in pregnant women to avoid radiation exposure. In some cases, a combination of imaging studies may be necessary to make a definitive diagnosis. Collaboration among healthcare professionals is essential to interpret these results accurately and to provide the best possible care for the patient.